Hello friends, today we'll talk about anal fistula. So fistula definition is abnormal communication between two organs or organs to a skin or organ to a blood vessel. So there are several types of anal fistula. We follow the Park's classification. So you can see there is intersphincteric, suprasphincteric, transsphincteric, or there are superficial fistula. So you can see this is the anal fistula. You can see clearly my fistula probe is passing through the external opening up to the internal opening. So my left hand index finger, you can see my right hand is showing this is the external opening, and my left hand index finger is showing the internal opening. So you can see external opening and internal opening clearly. Now I am pushing a methylene blue dye through the external opening up to the internal opening. You can see there will be spillage through the internal opening. You can see the spillage of that blue dye. Again you see. So these are the external opening and then the internal opening. Then I start doing the procedure. We are going for fistulectomy. So this is the internal opening. The cause of recurrent fistula after operation is not clearing the internal opening, not removing the internal opening, because in the internal opening actual infection remains, because the fistula occurs due to infection in the cryptoglandular area, okay, in the anal canal. So you have to remove the internal opening nicely. So you can see I have cutting the internal opening first, then cutting the skin over the fistula tract, okay. Then eventually I am going up to the fistula tract. So the significance of putting the methylene blue dye is that if I by chance cut the fistula tract, so we can notice it and identify it whether I am cutting the fistula tract in toto or not, or I am removing the fistula tract in a hole or not. Okay, so you should remove the whole fistula tract if you are planning for fistulectomy. You can see nicely the external opening and the internal opening. The external opening, as it was around 2 o'clock, and internal opening it was around 1 to 1:30 o'clock position. Okay, so in any fistula surgery you can do fistulotomy in simple fistula, or in intersphincteric fistula you have to do fistulectomy. In transsphincteric there are a lot of procedures like laser procedures, then lift procedures, okay, there are so many procedures so you can follow. So it was an intersphincteric fistula, so I went for fistulectomy. So you can see I am cutting the external opening and I am removing the whole fistula, okay. So during the procedures internal sphincter muscle will be divided and later we repair it. Some people may close the skin, some people don't. Here in this case there was pus discharge from his fistula's opening, so I decided to keep it open. But if there is only serous discharge, you can close the opening also, the skin opening, what I am saying. So I am taking out the whole fistula. Later I will repair the anal mucous membrane where I cut the internal opening, okay. So you can see the whole fistula has come, so we have removed the whole fistula. Now I am closing the anal mucosa, okay. So this is important step, so you should close. I am closing it by absorbing suture, that is catgut suture, okay. So you can see anal mucosa I am closing. Also the internal sphincter which I have divided, I can also close that, and I closed in this video. So this is almost an unedited video, so you can follow this procedure while doing fistula surgery. You can watch my other videos also regarding operative video, regarding other surgical topic video. Also for the PG trainees who are doing post graduation in surgery, also for MBBS student, I am putting one by one video regarding the practical viva exams and the procedures. So this also you can watch it in my playlist, okay. So I repaired the anal canal mucosa, then I am putting a anal pack into the anal canal opening, so it will give a compression and also reduce the bleeding. Thank you all, follow my YouTube channel. Thank you for watching.